A comfort break.
Good morning. Welcome to the December 19th and final meeting of 2017 of the General Session of the Franklin County Board of Commissioners. We'll begin this morning's meeting with the Pledge of Allegiance led by Commissioner Boyce.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right, we will begin this morning's meeting with a public hearing, and I'm sorry. We'll begin this morning's.
Yes, thank you.
We will begin this morning's meeting with need an approval of the minutes of the October 19th, 2017 administrative session, the November 14th, 2017 general session, and the minutes of the October 19th, 2017 briefing.
So move.
Second,
Moved and seconded voting, Commissioner Boyce.
Yes.
Commissioner Brown.
yes.
Commissioner O'Grady.
Yes.
The minutes have been approved.
All right, then we will begin with a public hearing, Franklin County Board of Commissioners. Couple things. Number one, I have a few speaker slips. If you intend to speak at this morning's public hearing, you need to fill out a speaker slip. You can find those in the back of the room, in the back corner. See Mr. Homan. Your comments this morning should be limited to 3 minutes in duration. We have a lot of business to get through this morning. It's the final meeting of the year, so we have lots to do, including voting out the budget this morning for 2018. So we will have this morning's comments timed. We will stick to a rigid schedule. So if when you hear the buzzer go off, you should wrap up your comments. We will try to be respectful of you wrapping up your time, but we will cut you off sometime soon after that. So please keep your comments. If you haven't filled out a speaker slip, please do that.
And get it to the clerk.
Yeah, get them over to the clerk. See
Or-
Mr. Lowry,
or
get them to him,
Mr.
and then
Lowry.
he'll bring them up to the clerk. And we will begin this morning with a brief message from the county administrator. Can I get a pen, please?
Good morning, Commissioners. Kenneth Wilson, County Administrator. I would like to make some brief comments regarding the public hearing on Resolution 890-17. I am respectfully recommending passage of this resolution.
Thank you.
After extensive analysis, it has been determined that in order to secure fiscal sustainability and maintain sound management practices of Franklin County, it's necessary to continue the collections of the 1% sales and use tax after December 31st of 2018. A sales tax of 1% is estimated to provide just over $60 million. The continuation of the sales tax will be utilized, if approved, $21 million to backfill the loss of Medicaid managed care revenue, $15 million per year to continue additional investments in the county's community partnership program, economic development initiatives, along with an enhanced investment in the county's sanitary sewer system. $12 million to cover debt service requirements on planned sales tax-backed bonds in order to complete the consolidation of the county's correction centers into one single facility on Fisher Road. This action will save an estimated $50 million per deferring this project for several years. $6 million per year to continue subsidies provided to our social service agencies and Homeland Security and Justice programs required from the loss of state and federal revenues, as well as the continuation of a subsidy to animal care and control. $5 million per year for capital investments, which include addressing issues with the county's aging infrastructure, such as the replacement of elevators and other overdue capital improvement projects. Franklin County is now the largest and fastest growing county in Ohio, one of the fastest growing, fastest growing metro. And with that growth comes increased responsibilities and challenges, such as addressing the high rate of poverty through job opportunities that earn beyond a living wage and programs that impact social determinants of health and well-being, implementing smart justice initiatives, as well as addressing addiction, mental illness, recidivism, and increasing the affordability of housing as rents continue to rise while incomes are not keeping pace with housing costs, and planning for future infrastructure needs. In future years, it would not be prudent to allow an ongoing structural budget gap to persist and totally deplete cash reserves over time. Therefore, county administration is recommending this action be favorably considered today. Thank you for allowing me this time to speak to this recommendation.
Thank you, Ken. Antoine, can you please read the public hearing into the record for us?
Public hearing, resolution regarding the continuation of the 1/4% sales and use tax levy pursuant to section 5739.021 and 5741.021 of the Ohio Revised Code for the benefit of Franklin County, Ohio.
All right. So now we'd like to open the public hearing for the resolution. Again, if you haven't filled out a speaker slip, please do that. We will take the speaker slips. I have 4 here currently. We'll take them in the order that they've been time-stamped into the record. And so our first speaker is Mr. Harold Thomas, the Franklin County Libertarian Party.
Good
Mr.
morning.
Thomas, good morning.
Morning. My name is Harold Thomas. I am the Executive Committee Chairman of the Franklin County Libertarian Party. We Libertarians pride ourselves on being the party of principle, and accordingly, it is on principle that I oppose this resolution. The Columbus Dispatch, in its editorial November 26th, wrote that the resolution breaks faith with the voters, reneging on a 2013 promise to sunset the 5-year tax. Now, just to be clear, I do feel that it is commendable that the commissioners want to maintain fiscal responsibility, and we all understand that a very real need exists for the county social services. Balancing the county budget is tough when the state and federal governments reduce their funding without reducing their mandates. However, none of this negates the fact that taxes, all taxes, and especially the sales tax, seize money that the poor need to feed and house their families, and that the rich can use to support local businesses and create jobs. The people of Franklin County have an inherent right, if not always the power, to review these taxes from time to time. More than 200 years ago, we fought a revolution on the principle that taxation without representation is tyranny. And I hope you will agree that any resentment that a young person would feel about not having a voice in passing this tax would be more than justified by our founding principles. As I see it, the commissioners have 3 options. First, you may redouble your effort to root out what the dispatch called mission creep and bloat in government operations. The best solution is simply to make this tax unnecessary. Secondly, you may put the sales tax on the ballot for a 5-year renewal. At least this way you will keep faith with the taxpayers by giving us an opportunity to decide how our money is to be spent. Or third, you could just break faith, ignore principle, and make the tax permanent. All I ask is that you make a principled decision, not just for Franklin County government, but for all of us.
Thank you, Mr. Thomas. Our next speaker is E.C. Green from the Physicians Care Connection. Good morning, E.C.
Good morning, Commissioners. I'm E.C. Green, and I'm the Executive Director of Physicians Care Connection. We're an affiliate of the Columbus Medical Association, and I brought some of my peeps with me, my staff. They're here. I'm here today to express my appreciation for the financial support that this community provides to our most vulnerable residents through your allocation of sales tax dollars and the community partnership grant to our organization. Using our unique model of patient-centered care coordination, PCC has achieved successful healthcare outcomes for high-risk, hard-to-reach populations in Franklin County. Through a network of over 1,100 healthcare volunteers, this is primary care physicians, subspecialists, dentists, and nurses, and 13 participating hospitals, PCC acts as a connector between people who are vulnerable and medical services. You have all of our statistical data on numbers on over the 2,500 vulnerable patients we see annually. These numbers are important, but there are real people behind this data. In 2016, we had a Hispanic man show up at our free clinic. Our volunteer doctor diagnosed him with stage 4 lung cancer. He did not have insurance. That night, our nurse prayed for him. The next day, she was able to schedule an appointment with him to see an oncologist. Shortly after that, he began a year of chemotherapy treatments. At the beginning of this month, he returned to our clinic to let our nurse know his cancer was in remission and to thank her for her quick actions that got him into care, ultimately saving his life. Access to dental care continues to be an unmet health care need in our community. Since 2012, we have served 1,841 people through our dental initiative. We provide extractions, cleanings, fillings, and dentures. The value of this care totals a little over $600,000. However, the true economic value of this care to this community is that we kept 1,841 people from seeking this care in the emergency room. Last week, one of our clients let us know that she had lost her Medicaid coverage. Her husband began receiving early retirement benefits 3 months ago, taking their monthly income from $1,700 to $2,100. Her prescription medication cost without insurance is over $2,000 a month. Our care coordinator was able to help her enroll in a plan through the marketplace with a monthly premium of $34 a month. With this plan, she will only pay $5 for her primary care visits, and her medications are only $5 each for each prescription. These examples of care coordination continue to be our experience. It is very resource intensive, but very necessary and ultimately very cost effective. The healthcare landscape in our community is complicated. Coupled with the challenges associated with the social determinants of health, there are a substantial number of our residents that will continue to need help when they are sick and coordination of care as they fall through the cracks. The funding that we receive through the community partnership is critical to providing these services. As you wrestle with financial decisions that will impact the future of the county, we want to help remind our community of the people behind the financial numbers. Your public financial support is a very practical benefit to our work. However, it is also a vital statement of a partnership to over 1,000 volunteer healthcare providers and our private funding supporters. We strongly urge your consideration of maintaining the current sales tax to allow for the funding of this work. Thank you.
Thank you, EC. Sorry. EC.
Come back, please.
Commissioner Boyce
Thank
has
you.
a question for you.
I really, want to say thank you for coming because it's a real live example of how the decisions we make impact lives and people. And when, what we're considering here, if we don't extend this current rate, there will be cuts. And your program will be cut because it'll be across the board cuts. And these dollars specifically go to agencies like yours
Absolutely.
that help people. And so I really wanted to make the point to illustrate that that's the kind of person, the gentleman that you talked about that got the oncology services that your agency provided, not to mention the prayers. That's a real life example of how the decisions we make affect lives and people.
Absolutely.
And it's not all just numbers and those kinds of things. It's a serious thing, and I just want to make that point because if we don't do it, those funds will be cut. Those funds will go away immediately, and those kind of people will be affected the most. So thank you for coming today and sharing that story. Appreciate
Thank you.
that.
Thank you. You guys are very welcome to come visit the free clinic anytime you want. Monday evenings, Columbus Public Health, and we open at 5 o'clock.
Having
we'll make a
been
point to do
there
that.
before, I
It's
know
cool.
the critical work that you've done and do, and the dental work that you talk about is for health as well as for just teeth.
Absolutely.
It affects
Their
general
affect.
health,
Yes.
lung, heart, and everything when people don't get the proper dental care that they need. And those community partnerships we talk about, as kind of just a partnership. It's more than that. These are critical services in our community that affect people's lives every day. And you're right, Commissioner Boyce, they would go away immediately. And that's frightening to me because health, without your health, without food, without housing, I mean, these services go away.
Absolutely. And usually they're very layered, like you said. It's medical, but then there's also social services, so there's people without food. And just think about your teeth. If you don't have a good set of teeth or a nice smile, that impacts somebody's overall self-confidence and can preclude them from getting something like a job. And so we're happy to continue providing these services because we know that the value of this goes on longer than the short time impact that it has.
Thanks, Ms. Green.
Thank you.
Thanks, Cece. Michael Vincent is our next speaker. It's our last one.
Hey, Commissioners. Michael Vincent here again, native of Central Ohio and a resident also. And I'm here to oppose the proposal to extend the sales tax for several reasons. For one, it's a jail expansion. You're expanding or proposing to expand the jail system from 2,343 beds to somewhere between 2,400 and 2,800 beds. There's no evidence to support this expansion. So, for instance, there's no relationship between crime and incarceration. Also, you haven't taken the necessary steps to decarcerate the jails despite the alarming rates of pretrial detainees in your jails. The pretrial detainees or detaining somebody before they've been convicted of a crime is a human rights abuse, and it's also a violation of international law. So I'm opposed to the expansion of the jail because you're talking about taking steps to reform the jail and provide necessary services, but you haven't taken the necessary steps to ensure that human rights abuses have not been committed. So what I'm talking about is the UN Special Rapporteur on Torture is calling for a criminal investigation into the incidents involving 15 videos they looked at where correctional officers were torturing prisoners in the Franklin County jail system. One was a pregnant woman who was tasered while she was naked, and then she had a miscarriage as a result of that. So I'm also opposed to jail expansion because jail, like prison, Commissioner O'Grady, is a direct vestige of slavery where prisoners are subjected to the will of others. Prisoners are dependent on others for basic human necessities. Prisoners are isolated from the general population, making the state anti-family and anti-community. Prisoners are coerced to work against their will, and prisoners must also follow daily routines specified by their superiors. I am opposed to jail expansion because jail is a disabling and traumatizing environment, making it impossible for prisoners to receive quality health care. The sheriff, for instance, contracted with a provider called NavCare that the state of Alabama contracted, but then they canceled their contract with NavCare because there was an audit that said that they were providing extremely dangerous and poor quality health care. And lastly, I'm opposed to jail expansion because you have prisoners that are dying in the sheriff's custody. One recent example is Brent Gibney, who was incarcerated for 7 months, died of a fentanyl overdose. So the question I'm asking is, how did this fentanyl get into the jail? Wasn't the prisoners that smuggled it in? It had to be the correctional officers. This idea that you can receive quality treatment for drug dependency There's no evidence to support that. So again, I'm opposing the proposal to use this sales tax in order to expand the jail system, and I'll now take any questions or comments from the commissioners.
Does anybody have any questions or comments for Mr. Vincent?
Yeah, I'll say something. I'm just going to respond because I feel like I don't want. I think it's important. We just disagree on. This new facility does, in my opinion, the opposite. It's going to provide us the ability to provide for a greater menu of care to those who come in our system, which include better mental health services, it include better health care services, better triage for other needs, and that's a critical part of the rehabilitation process. As I said, as a new commissioner, I've been able to give a fresh review of what our current facilities are like and what we have or don't have the capacity to do. And I just think it's important for the public to understand that what this new facility does is it gives us an opportunity to better protect the public, to better, when someone comes through our doors, provide them with the resources they need to be a successful citizen. And all the things that you identify, these are areas that a new facility, a new age facility, will allow us to be able to better manage, to better address, to better review. And so I think it's just a fundamental disagreement. Let me also add that we're required by the Ohio Revised Code, our state law, to provide this service to this community. And for that, we have to do it to the best of our ability. And so that's what this new facility does. This is a partnership with Franklin County. This is a partnership with our community in order to protect them, to provide them with the best resources that we can so that all of our citizens can be successful no matter what their current challenge situation is. And specifically to the recidivism and to, I know Commissioner Brown, this is something she worked on for years, and that's to ensure that when people do come through our doors, that they have a pathway to success in life. And I think Franklin County is a leader. As a legislator, I learned that Franklin County was leading the way in providing services and resources for folks to be successful. Now, are we perfect? Do we get it right every single time with everyone that walks in the door? No, but we're working toward that end, and I think that's worth this investment. It's worth this conversation, and so I hope in the end you'll work with us to help us address those gaps so that we can learn from your knowledge, learn from some of the feedback in the community, and make sure that we're giving those folks the best resource we can to be successful. And I say that only because it's a public forum, folks are listening, and I want to make sure that they have the facts and all the information. And so I just want to give that counter perspective.
I think you're right to say that, and I would say again, Mr. Vinson, I appreciate your comments. I disagree with you on a lot of what you've said, and I wonder what you would have us do. We are mandated to do this, as Commissioner Boyce said, and in that mandate, it doesn't lay out how to do a correctional center. Through extensive research and visiting other correctional centers around the country with the sheriff and their deputies, their chief administration, we determined the best way to do a new correctional center, and there is no disagreement, we need a new correctional center. We're doing it in the best possible way to provide the space and the ability to give anybody who enters that facility what they need so that when they get out, whether they're pre-sentencing or after sentencing, when they get out of that facility, they will have the ability to be successful on the outside, and with respect and with accountability that they will get when they enter that facility, they will have the ability to get quality services that we can't provide in the current facility at all. So we have a partnership with the sheriff's office, who are the tenants, and we are the owners of the facility. We're working hand in hand with them to provide this. And there's been extensive research done and visiting of other facilities. So we do disagree, I know, and as Commissioner Boyd said, we would like to work with you to provide this.
Mr. Vinson, I appreciate your passion for this issue. We've had 3 public hearings. You've been here 3 times speaking very passionately about your thoughts and your beliefs on this issue. So I appreciate all that you've brought to this issue and the awareness that you brought to this issue for the commissioners. So thank you for that. So
Can I please respond? I'll take. So on the issue of mandates, I understand you have a state mandate to fund the law enforcement functions, the courts, the sheriff, of which you're allocating a majority of the budget towards. I feel that this is misguided public policy. I remember when our taxes used to be used to fund things like education and public housing. Those taxes over the last generation have been diverted towards the performance of law enforcement functions and incarcerating people, and we know that that has not really solved any of the social problems. That's based on the research. You mentioned research, and I know that the father of gynecology, he performed his research on women that were incarcerated in the state of Indiana, which was the results of a lot of sexual trauma. And that's one of the reasons why I'm calling for an end to strip searches and body cavity searches, because with the Pathways program, you're claiming to be helping women, but you're traumatizing them during the intake process. Speaking to the mandate thing, ORC, you have a mandate, an international mandate that's based on international humanitarian law, not to detain people who have not been convicted of a crime, and not to use corporal punishment in order to torture prisoners. So that's it. Thank you again for allowing me the opportunity to speak, and I look forward to working with you so that we can prevent jail expansion in Franklin County.
thank you. Next, we have Jennifer Seifert of the Charitable Pharmacy of Central Ohio. Good morning.
Good morning, Commissioners. Good morning. I am Jennifer Seifert. I am the Executive Director of the Charitable Pharmacy of Central Ohio. Thank you for this opportunity to talk with you about our unique pharmacy and how being a Franklin County community partner improves the lives of our most vulnerable neighbors. The mission of the Charitable Pharmacy of Central Ohio is to provide affordable medication and pharmacy services and coordinate health care for those most vulnerable in our community. I would imagine that many of you here today have been to a pharmacy to pick up a medication for yourself or a child or a parent or loved one, and come to the pharmacy and discovered that the cost is much higher than you anticipated. The high cost of medications is a national problem, and the Charitable Pharmacy exists to make sure that our patients who are living in poverty do not go without life-saving medications, that they don't suffer the anxiety of not being able to get their medications, and that they don't experience a preventable hospitalization. We provide medications at no charge to patients who live in poverty, and our qualifications are that you are a Franklin County resident and you are under 200% of the federal poverty level. Since opening in February of 2010, we've dispensed over 330,000 prescriptions worth $27 million in medication. Of that $27 million, 95% of it is donated to the Charitable Pharmacy. We receive medications from long-term care facility pharmacies, from pharmaceutical manufacturers, and from charitable dispensaries. We do have a budget to purchase medications, so we have spent about $1.5 million purchasing medications. But that means that for every dollar we receive through donations, we turn that into $8 of medications for our patients. Not only do our patients receive medication, but they receive much more. Each time a patient comes to the pharmacy, a pharmacist or advanced intern sits down one-on-one with them and goes through their average of 7 medications, counsels them on their medications, takes their blood pressure, takes their blood glucose, and then communicates with their physician or nurse practitioner if we discover problems in their medication therapy. We have published data that demonstrates that the charitable pharmacy services produce a reduction of 1 hospitalization per patient per year once becoming a patient of the charitable pharmacy. With a demonstration of increased quality of life and reduction in hospitalizations for our patients, we are a model which has garnered attention from other counties and other states. I regularly receive phone calls and emails from around the country about them wanting to start a charitable pharmacy like we have here in Franklin County because they've seen the published results and they've seen the impact that it has produced here in our community. Thank you to the commissioners for the support for our program. We wouldn't be able to have these mechanisms to produce this service without the support. I appreciate it. Thank you very much for the opportunity to present this as well.
Thank you, Jennifer.
Thank you. I promise I'm not going to speak on every speaker that comes up here today. We've got a lot. But I just want to take a minute to emphasize this. Medication is, in many cases, life-saving, and so another example of how these resources are used, and they really touch someone's lives. And in this case, it can be life-saving. You know, I've got my oldest child had seizures as a kid, and we had to get medication. And I can't imagine what a family would face without. We had the means to get the medication, but I can't imagine what a family would do without access to those resources for their child, and that in many cases could be life-saving, you know, and the difference between that citizen growing up into a productive, healthy part of Central Ohio and contributing to the quality of life for everybody. And so, again, I want to keep it all in the context of, you know, these aren't just numbers on a budget spreadsheet. These are people's lives that we're talking about, and the decisions that we make as commissioners are rooted in that basic premise. And so thank you so much for coming and sharing your story about the pharmacy. Thank you.
Thanks,
Thank you.
Next, we have, unless we have other speaker slips, next we have Stephanie Hightower of the Columbus Urban League.
Hey, Ms. Hightower, how are you?
Good morning.
Good morning. Thank you, Commissioner President O'Grady and Commissioners Boyce and Brown. I'm here to speak in support of Resolution 89017. And for those of you who don't know a lot about the Columbus Urban League, for nearly 100 years, we have provided hope and inspiration for African Americans and those underserved in the urban core. And so, you know, I'm just really here to say one thing. Living in poverty is expensive. Being underemployed and unemployed is expensive. Being homeless is expensive. Having the high rates of evictions in our community as they relate today is expensive. Coming home as a restored citizen to our community without a job is expensive. Not having a 700 credit score and having to go to payday lenders is expensive. Not having access, as many have said today and this morning, to affordable and the appropriate health care is expensive. And so I believe that this tax will help to close the economic disparity gap that exists in our urban and poor neighborhoods. And without it, we will continue to grow that gap. And so I support the work that you're doing in making sure that we can expand this sales tax for our urban community and for those individuals and those families who live in poverty, and especially those children who live in poverty every single day. Without the work, without the help that you provide us at the Columbus Urban League, we would not be able to deal with a lot of the issues that continue to rise in our community on a day-to-day basis. When you look at now the number of African American women in our community right now who are single heads of households, who now are homeless, are 3 times, our rate in Columbus is 3 times the national rate in the country of African American women who are homeless. And without having a sales tax to be able to provide the necessary funding for a lot of the work that we do at the Urban League to relieve the stress and what comes with that, we would be in trouble as a community. So I commend your continued work to help us to deal with our issues of poverty and economic disparity in our community. And I thank you for this opportunity to speak.
Thank you.
Thank you. Without the funding that we provide directly to the Urban League, what would you do? What would that impact be?
You know, we would not be able to provide after-school programming for young children. We would not be able to continue to have a workforce development program to help get people to work. And we're not talking about just getting to people to work with minimum wage jobs. We're talking about training, technology training. We're talking about putting those individuals in real jobs that then go on to being careers. Without those dollars that the sales tax would provide, we would not be able to implement a 700 credit score program. We would not be able to have our landlord-tenant counseling. Those are the kinds of things that would directly be impacted in our community, and that would be huge. We would not be able to serve those returned citizens that are coming back into our community and need to have the kind of training that they not only training for employment, but just being able to recreate their lives, to be able to help them to begin to find housing. We would not be able to do those things. We would not be able to have a My Brother's Keeper program for those young boys, 11 to 14, to be able to keep them off the streets so that they are not involved in gang-related activities. We would not be able to do those kinds of things, and so we understand the importance of what this sales tax does. It's important for all of us to give back just a little bit, and that's what that sales tax is. It's just a little bit of our income that really goes to help our community, and really is to help all of us long term.
Thank you.
I only add that despite the challenges that we face, and the Urban League is certainly on the front lines of that fight, our Urban League has been selected to host the National Urban League Conversation in 2018 or 19?
Next year.
18, so 2018. And part of that is because of the innovative things that we're doing and the commitment that Central Ohio has shown toward that fight. And I just want to highlight that because while we've got some challenges, as you stated in the statistics, there are many things that we're doing to address those things, and we're working right, and people would see it nationally. And so this is a part of that broader investment, that broader strategy and conversation. And so I want to highlight that because that's a great accomplishment, not just for Urban League, but for Central Ohio.
We have Stephanie's predecessor, the former president of the Urban League, Sam Gresham, in the room with us as well.
Yeah, absolutely. I've worked with him a long time.
And he helped to lead the way to ensuring that this Urban League affiliate is where it is today. And to your point, Commissioner Boyce, you're absolutely right. We will have a national platform next summer from August 1st through the 4th, where we will be talking about those economic disparities that are directly impacting the African American neighborhoods and urban cores. But you're right. What we will also have the opportunity to do is talk about the work that is going on in Columbus, Ohio, to talk about the support that the county commissioners and the county actually does do to support the Columbus Urban League and its work to be innovative and to be able to make sure that all of our citizens have access to that economic life that we all want to achieve.
Thank you.
Thank you.
All right. So, being there's no other speakers, I'd like to close the public hearing. And before I have the clerk read the resolution into the record, I've allowed, we've heard from a lot of speakers this morning, predominantly those for the continuation or the expansion of the tax, a few from the perspective of being against the expansion of the tax. I've allowed for both my colleagues, Kevin and Marilyn, to question and comment on, because those of you, anybody that's read or heard, you've known for a while that I've been the proponent of expanding this sales tax all along. I've been the one that's been the vocal one about the expansion of this tax. But I want to say something before we call for the question. For those who have come in opposition to the expansion of the tax, and for the comments made by respectfully from Mr. Thomas this morning and from others who have questioned why we would consider going back on a commitment that was made 5 years ago when we brought this tax forward. I don't take this very lightly, going back on a commitment that was made. But I don't ever take going back on a commitment that was made. My father taught me years ago as a child, you don't break a commitment. But, you know, we didn't have a crystal ball back then. We didn't know that when we entered into this commitment that our partners, and I believe in working very closely with partners, but we didn't know that our partners in state government and our partners in federal government were going to break their commitments to us, and that our partners in state government and federal government were going to once again back down from their commitment to us. You know, we expanded the sales tax the first time. We did this. We raised the sales tax in 2013 the first time because of the cuts to local government fund, the commitment that the state had made to local governments across the state for more than 80 years. We were cut by the governor and the legislature by a huge amount of money, and so we had to raise the sales tax to be able to withstand those cuts. And we did that back then, and we didn't know that we were going to get hit by the state again, by the governor and the legislature again, and put into the situation that we were, and we were going to have to withstand, you know, those type of that type of hit from the state government again. And so, for all the reasons that you heard from the county administrator earlier, and all the things that we're faced with, and all the things you heard from our partners, and all the reasons why the county government's faced with the increases and the demands that we are faced with, along with the $21 million Medicaid MCO expansion that the state chose to make themselves whole, yet make county governments all across the state of Ohio, in particular Franklin County, have to face. So when your partners do those kind of things to you, you're faced with decisions that we've been faced with. And so I don't take going back on a commitment very lightly, but sometimes you're forced by your friends and your partners in this business to have to do things that you don't like to do. And so somebody's got to make a hard choice. And when folks at the State House and folks in federal government don't make hard choices, they make easy choices to make themselves look good, somebody's got to make a tough choice. And so we've been forced a few times to make tough choices, and we don't shirk our responsibility in making tough choices. We make tough choices. And so that's why we're faced with doing this, and that's why we're doing what I believe we're going to do today. So
I think it's interesting that when we did the original action in 2013, nobody questioned our ability as a board of commissioners to do what we did, rather than go out to the community and ask for others to make that decision, because we took our responsibility as elected officials to do our jobs. Now, I think, and I do take this very seriously, and I have been struggling with what we need to do, and I do see we have, if we don't take this action, and I've listened to everybody, and I've tried hard to reconcile everybody's comments with what I know to be true with what our budget is and will be. If we don't take this action, we will be hurting all of our partners' work that extends our work in the community in an essential way and helps our budget. But this is the job of what our board does. This is not the job that we delegate out. We are elected to make these very difficult decisions, and I'm puzzled that it's turned out to be this kind of decision.
We increased the tax and the room was empty. We're
I
extending
know.
a tax and the room's packed.
And it's not an increase, and
Bizarre.
I don't understand.
Bizarre.
It is, and I've struggled with this because I know this is not easy stuff, and I know our residents depend on us to make difficult decisions, and if we don't do this, I am very concerned with the growing population, the growing older population, the growing disparity in income that we have, all of the things that we're doing. We have increasing needs and decreasing resources, and we've not increased our general fund budget by much, and I don't understand. So, I feel that this is necessary for us to make this decision.
I'll just add to one, I want to thank those who did come out to the multiple hearings that we had, some in the community, some right here. The one thing I will point out to my colleagues is that looks like you've got this time, I wasn't here last time, but in the room there are more people who understand and support this action. And I think that says something to the understanding of what we're about to do. I do want to point out a few things on a technical level that are important to consider. This is really for the public. The current rate is at 1.25%, and that's what Franklin County as an institution receives. That rate, as it relates to the other 88 counties, there would be 48 counties with higher rates than Franklin County based on the 1.25% that actually comes to Franklin County. There's this reference that we have the second highest rate. Well, that includes a portion of the sales tax that goes to CODA that we don't see as Franklin County, that is for public transportation. The other part, the greatest portion of the sales tax goes to the state of Ohio at 5.75%. And so when you think about why we're taking this action to continue the current tax rate, and you consider what the state gets, of which is the vast majority of the sales tax, we are put in a difficult position by the state of Ohio to have to make the decision to continue the 1.25% rate that Franklin County currently employs to its citizens. Let me also point out that making this decision wasn't easy. From the very start, I'll admit for myself, I was skeptical. But to me, it comes down to a couple of things. First, what has been referred to as a structural imbalance. Do you have less coming in? Do you have less or more going out than you have coming in? And that's a basic math. And if we don't continue this because of the cuts from the state of Ohio, it means that we will have less coming in than we have going out, which means ultimately that we make cuts. And so you heard from the agencies the story about the gentleman receiving oncology services who might have died. Well, that agency got $300,000 to help support those who are in need of medical services last year or this year. You heard about access to pharmacy and medications that people need to live. And that agency got $65,000 from Franklin County to ensure that people who couldn't afford medication or access to those resources would have that access and have those resources. And then certainly you heard from the Urban League, where they do an array and a menu of services to support those of our citizens who are most in need. And their CEO talked about homelessness and job placement and housing access, and I can go on and on and on about the different parts of our demographics that come through the doors of the Urban League and are afforded an opportunity to success in life. And that's really what we're talking about, giving them access to resources. And I'm sure that we give a substantial contribution to the Urban League, and we're partners with them. That's why I know that. And so let me make sure I get all my points in here. Last point. I've got more. I could go on and on about this, but I'm not. The last point I'll say, and this is important, and you have my commitment on this as one commissioner, and I'm sure my colleagues would likely agree with me on this, is that what we're doing is we are continuing the current rate. And while we are not at the capacity that the state of Ohio revised code allows us to get to, we always have the option of rolling it back. We always have the option of considering rolling it back. So let's say, for example, the economy becomes robust and we're taking in much more, and we're just flush with money and resources. Then that's something as commissioners we also have to consider, that maybe it's time to roll back the rate and look at that. And so I will promise you that we'll consider that, should those things happen, because none of us want the public to be taxed. We all know that there are people who could use that money in their pocket. And so from our standpoint, we do have that option, and I'm saying that right, we do have the ability to roll back at any time, just like we have the ability to go forward. And so should things change, should the equation change from the state and they start giving us our fair share and living up to the commitment that they have with us, that's something that we'll have to consider at that time, looking at all of the pieces, looking at all the considerations. And so I think based on the recommendations from staff, based on what we know about the need from the community, the option is to cut all of those programs and they would be completely wiped out from our funding. And then to make cuts at the service level here at Franklin County, there'd probably be layoffs and so forth. That option, and last one I might add, I know I said that before, but I'll add another one. I'm an investment banker away from politics, and that I do public finance. And one of the things that rating agencies look at when they're considering your ratings, which determine how much you borrow, the rate to which you borrow money from, they look at your tax capacity and, more importantly, your willingness to use it. And so for some people say, well, you should use you got this reserve fund, you should tap into that. If we tap into that, there will be a material consideration on from our rating standpoint, which could result in higher rates, which means that we'll make up that money when we borrow. It'll cost us more to borrow. And so by reducing that, you are at least implying another consideration. And in that case, it wouldn't be a prudent decision. The prudent decision, in my opinion, is to continue the current rate, to review it as we go over the years, and if there's an opportunity to roll back, do that. Again, with the same prudent considerations, but more importantly, to ensure that the structural imbalance does not occur in 2018. And so for that, I will be supporting this continuation resolution.
Last point before we vote on Resolution 89017. It's not in my budget message for later. It's not, but it's something that we point out all the time, but it can't be overlooked in this conversation. We are in the top 1% of the 3,069 counties in the United States. We are in the top 1% of the best managed counties in the country. We are the envy of almost every other county in the United States for the way that we are financially managed. We have been recognized over and over again. We are double AAA bond rated. We meet with our colleagues across the United States at the National Association of Counties. We meet with our colleagues at the County Commissioners Association of Ohio. Franklin County is the envy of every county in the state and most counties in the United States. We are financially sound. We have been recognized over and over again. And we are in the top 1%. So we don't do this lightly. We don't do this as an exercise. In just that we don't take this as something that is just is something that we do lightly. We have been put in this box, and we consider this to be the only way out. I've been down this road before. My colleagues have struggled. We've struggled with this and struggled with this and struggled with this. Kevin has done a huge amount of research in his first year as a county commissioner to come to this decision. So we have been here. You know, this is not. I mean, we've lost sleep over this. The staff has lost sleep over this. We've put in hours and hours and hours. Ken's lost hair over this. So, anyway, you know, please understand, this is something that you know, we have sought counsel on. We have, you know, this is, we believe, the right thing for the financial well-being of this community. We are doing what we believe to be in the best interest of this county. So, could you please read Resolution 890-17 into the record?
Resolution number 890-17, resolution regarding the continuation of the one quarter of 1% sales and use tax levy pursuant to sections 5739.021 and 5741.021 of the Ohio Revised Code for the benefit of Franklin County, Ohio.
Commissioners, Chris Long, Deputy County Administrator. I would only add, in addition to the comments that all of you have made and the County Administrator, that the Ohio Revised Code requires 2 public hearings. This board has conducted 3 public hearings, one in the evening in the community. All of the meetings had been properly noticed as required by the Ohio Revised Code. And for the decisions or the recommendations made earlier, County Administration recommends this action. I'll defer to the County Administrator for any additional comment, if any.
Kenneth Wilson, County Administrator. Board, I have no additional comments other than to reiterate, I believe that this is a sound plan that has been put together over a significant amount of time. There was significant analysis that went into this. And as Commissioner Boyce said, there is a commitment to financial planning in this county. Therefore, we will continue to monitor the state of the county's finances through our fiscal forecast and recommend the appropriate actions along the way. Today is not an ending, let's just say it's a continuation of sound financial planning. So again, I wholeheartedly recommend favorable action on this resolution.
Need a motion?
Move for passage of Resolution 890-17.
I'll second and acknowledge that we have continued our prudent and fiscally responsible practices since I've been here, and will continue, I know, under the leadership of Zach Telerik and our budget team, with leadership from County Administration. And I want to thank everybody for working on getting all of the information that I've asked for.
Moved and second in voting, Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 890-17 has been adopted.
Thank you.
Thank you.
All right. Due to time constraint, we need to take Resolution 898-17 next. Excuse me. Just that one. We're not going to move to all of the JFS resolutions at this point. Just that one. I see that look on your face, Director. Yes, it's yours. Yes, we have our guests have an appointment they have to get to, so if we could take the resolution with T Street and Stephanie Bland so that they can get to an appointment, and then we'll move back to the Court of Common Pleas after that.
Oh, yeah, we have the white coat science.
And then I'm going to have to excuse myself for a second after we get on this. Yes. Yes. Well, that was just the length of an entire meeting right
I
there.
know. It's going to be a long morning.
I know.
Long.
We got the budget to do it and everything else. So.
Wow, what do we have here? A science experiment.
Fabulous T Street.
No, amazing T Street.
Whatever superlative fits for the morning.
Amazing. It's the amazing T Street. And her amazing students.
And principal.
What the heck?
What do we have here? Good morning.
Good morning, Commissioners.
Good morning.
As our young people get set up,
Like a wand or something.
I'm going to give them an opportunity to get set up.
think it's-
But I wanted to first come and thank the Commissioners for, first, your past 2 years of funding for the Health Sciences Academies, our implementation of that program. Your contributions and your funding has made it robust. You'll get a chance to see today. The research tells us that low-income kids and kids of color are kinesthetic learners by nature, and that they learn when they do. If you look across the state of Ohio, you'll see the lowest scores aren't in reading and math, they're in science. And a part of that has to do with the fact that so much of our science comes out of textbooks versus out of learning. And in low-income schools, they don't have the labs that you see in some of the suburban schools. And so your funding has made possible some of the opportunities that the kids in the 7 health sciences academies have enjoyed. We appreciate your funding in the past. We are hoping that you will continue to fund us this year, and so we wanted to come in. As you know, I like to show you what you fund. A lot of people talk about what they do. The bottom line for us is results. Everything else is rhetoric, and I think if you look at the scores, we have students here today, and the principal, who I will introduce in a moment, from Champion Middle School. When you look at the gradual increase at Champion Middle School, you'll see that we know what works. The question is, do we have the will to fund and to do what we know works? And so we thank you for having the courage to fund what works in advancing our young people. So the Health Sciences Academies are comprised of 7 schools on the Near East Side: East High School, Champion Middle School, Eastgate, East Columbus, Beatty Park, Ohio Avenue, and Trevitt Elementary School. So there are 7 schools for which your funding supports. And so the young people from Champion are going to do a demonstration for you today, but I would be remiss if I didn't allow their principal to introduce them, the future doctors. Someone asked them this morning, which one of you want to be doctors? And they all turned around and looked at her like she was crazy and said, well, we all do. So this is what you're funding. And so I want to introduce to you the principal of Champion Middle School, Stephanie Bland.
Good morning.
Good morning, Commissioners, Franklin County. Good morning, members and guests. My name is Stephanie Bland. I'm principal at Champion Middle School. Number one, I want to thank you. Thank you for giving our students, who are 100% our future, this opportunity. And so today, they are going to demonstrate and tell you about what's been going on at Champion Middle School and the other 7 schools in our feeder. We have worked on this for the last 4 years. This will be my 2nd graduating class, and I'm very proud of them. Future doctors, you're on.
Microphone. Yeah, there you go. She knew to take the microphone.
I can take it off.
You
Yeah,
can
take it over.
Take it off. Yes, ma'am.
Take it off there and take it over with you.
Good morning.
Good morning.
My name is Desjanique Braxton, and I am an 8th grade student ambassador at Champion Middle School.
Good morning. My name is Lawrence Rao. I'm also an 8th grade student ambassador from Champion Middle School.
That's a big.
Good morning. My name is Lanasia Hill Colwell. I am a student, not a student ambassador at Champion Middle School.
Let's see this experiment.
So first I will be talking about the Science Cafe that we have. So at the Science Cafe, we talk about snacks or food that give our body energy and mind power.
Second, we'll be talking about what we did at East High School, a science and health fair. We demonstrated the lungs and we demonstrated the heart and the organs in your body.
Good morning. Once again, my name is Lawrence Rao. We are students from Champion Middle School. Our school is about the Health Science Academy. Other professional and science-related fields. During the school year, this program gives us students a chance to interact with medical, health, and other professions in science-related fields. We are able to ask questions about careers and see firsthand what their job is all about. During the school year, students, staff, and other professions have science fairs, cafes, class visits, and field trips. At science fair this year, our school will speak about health versus unhealthy lungs. These lungs are from adult pigs. These shows in unhealthy lungs which cannot inflate or hold the amount of oxygen needed for the body. Often, a person that has smoked for a long period of time will be short of breath and need medication to help their lungs bacteria to. This is a healthy lung which appears pink. This lung will This is a healthy lung, which appear pink. This lung will allow more oxygen to be stored and sent into the bloodstream where it can be transferred to the rest of the body. I thank you.
Wow. Wow. Don't smoke.
So as people are talking about, as we're talking about smoking cessation, this is a great example for our young people early. How do you prevent it? Folks from smoking, you prevent it before it starts. And so our young people got a chance to see what a healthy lung looks like. And for the record, they have their gloves on because this is a pig's lung, and it's a real lung. And so they're handling it because it has chemicals that have been stored. And so what we've done is we're now sharing it with the other 7 schools of the Health Sciences Academies, and your funding helped make that possible because that's something that our budgets could never have afforded from our schools. But as you see, our young people are excited. People always say, you know, how do you prepare the future? You prepare them now, recognizing that they're not just our future, that they're our present. And so we're excited to come before you again and asking you for continued support of the 7 Health Sciences Academies. I think that you get a good bang for your buck. You support almost 2,000 kids with the monies that you provide us. And we're extremely grateful on behalf of Partners Achieving Community Transformation, Columbus City Schools, and The Ohio State University, who are the partners of the Health Sciences Academies. We thank you, but we humbly ask for your continued support this year for these young people and for the other 1,999 kids who are in the Health Sciences Academies. Do you have any questions for any of us?
Yeah, how'd you find the pig that smoked cigarettes?
That was a good question, Commissioner Boyce.
Yeah, I'm trying to see that.
So that particular pig lung is a simulation, but the other one is actually alive.
Right.
And so we have a partnership right now with the OSU Veterinary Medicine School. And so when they found out that we had to purchase that lung, they were like, "Wait a minute, we can get you parts of animals, and we can use those." And so that's a new way we're going to use our partnership. And so that will save us money in the future as well. We're always looking for cost savings to make this partnership work. But as you can see, we have amazing young people in this feeder pattern. These are just 3 of the nearly 2,000 students who are doing great things. I love to look at our grade card for Champion Middle School because almost 7 years ago, the U.S. News and World Report listed Champion as one of the lowest performing schools in the state of Ohio, as the lowest performing middle school in the state of Ohio, and one of the lowest in the nation. And today, when you look at their reading scores, they're on par in terms of their growth in reading and math with kids who are in suburban schools. And when you see that, we always talk about the district sweeping grade card, but we don't know that there are lots of gems within that district, and you have to go in and unpack those numbers for all of our schools. And you have to know how to read the grade card to know what progress looks like. We didn't get into this situation academically overnight, and we're not going to get out overnight. But I'll tell you, this year, the kids at Champion had 3.7 years of growth in math in one school year in 7th grade.
That's awesome.
I'm so grateful. We have 7 amazing principals. Leadership matters. We're at the table in the selection of those administrators. Right now, we have a partnership that's working, and so we thank you. And again, we ask you for continued funding. If you don't have any other questions, we're going to let our young people go back to school because
Definitely.
that time in the classroom matters.
It does.
Commissioners, thank you so much.
Thanks, guys.
Thanks, T. Good to see you.
Good job.
Thank you.
Yeah.
T, you need to be in the picture along with.
Yeah. They take their gloves off? No, that's okay.
T. Good to see you.
I gotta read it.
Yeah, you do.
Yeah.
Okay.
Resolution number 898-17, resolution approving a subaward agreement with Partners Achieving Community Transformation for Health Sciences Educational Programming and Parent University Instruction in the amount of $149,293.98.
Again, Commissioner Joy Bivens, Franklin County, Director of Franklin County Job and Family Services. PAC is a collaborative partnership between the Ohio State University, Columbus Metropolitan Housing Authority, City of Columbus, and stakeholders who are taking a holistic approach to the community on the Near East Side. Improving education outcomes is a key component of this initiative. This resolution will fund health science programming and co-curriculum experiences developed and offered in conjunction with COSI for estimated 2,300 students, elementary through high school, across 7 different Near East Columbus schools. It will also fund a second year of the PAC's Parent University Workshop Series, which is designed to provide parents and caregivers with resources to become better educational partners with advocates for their children. Many times as we have students in schools, it is a school success many times is at a higher level when parents are engaged. And I believe that the Parent University is one of those models that is phenomenal and it is working. And pending any questions, I would ask for your approval for my one resolution.
If there,
For now. I'll be back.
if there are no comments or questions, move for passage of 898-17.
Second.
Moved in second and voting, Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 898-17 has been adopted.
Thank you.
We'll bring you back. Court of Comment, please.
Resolution number 891-17, resolution authorizing a contract between Alvis Incorporated and the Franklin County Board of Commissioners on behalf of the Franklin County Common Pleas Court for a medically assisted treatment program in the amount of $1,084,035.
Good morning. Well, first of all, I didn't bring pig parts with me, so it's gonna be ours are gonna be a little boring. I apologize. I would have brought
pig
props
lung
with me.
today.
You
You didn't know.
just have the lungs in me.
You got the holiday sweater.
That's right. That's right. Susan Bedsole, Deputy Court Director. With me, I have Lori Francescan, our Chief Probation Officer. This resolution is for an agreement with Alvis Incorporated to provide the necessary programming and staff to implement our medication-assisted treatment program, otherwise known as our POWER program. Alvis provides this specialized programming for approximately 150 program participants who have an opiate addiction. They do subcontract with OSU's Talbot Hall, who provides the actual management of the administration of the medication. I do know that you have received the information.
That was very
that we had
helpful.
discussed
Thank
previously.
you.
Good. I was hoping you found that useful to you. Pending any questions, we would request approval.
Good. If there are no comments or questions, move for passage of resolution 891-17.
Second.
Moved in second and voting, Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Resolution number 891-17 has been adopted. Resolution number 892-17, resolution authorizing a contract extension with Redwood Toxicology Laboratory to provide drug testing in the amount of $135,000.
Again, this resolution is our fourth and final extension of this contract with Redwood Toxicology. We send a little over 20,000 substance tests out each year. We will be rebidding it in 2018. The contract terms and pricing remain the same as they have for the previous extensions. So again, pending any questions, we would request approval.
If there are no comments or questions, move for passage of 892-17.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Resolution number 892-17 has been adopted.
Thank you very much. Happy holidays.
Thank you. Happy holidays to you too.
The auditor.
Resolution number 893-17, resolution approving 10 contracts for mediation services in the amount of $100,000.
Good morning, Commissioners.
Morning.
My name is Alain Orlin. I'm the Director of Real Estate with the Auditor's Office, and with me is Brian Katz, our Chief Counsel. We are here before you today respectfully asking for passage of this resolution about the Board of Revision Mediation Program. This mediation program has been implemented since 2013 to provide support for the Board of Revision in order to resolve quickly and efficiently the evaluation cases for the benefit of our taxpayers. The County Purchasing Department oversaw the competitive qualification process and made sure that our 10 finalists met all the criteria set forth in the request for qualifications. And the highlights of this expenditure are as follows. First of all, the mediators will assist the Board of Revision in mediating the cases assigned to the mediation department. Second, they will draft the stipulation and waiver document for the taxpayer's signature. And last but not least, they will make sure that the stipulation and waiver document is returned to the mediation department for the Board of Revision's final review. Thank you very much for your time and consideration.
Sure. If there are no comments or questions, move for passage of 893-17.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 893-17 has been adopted.
Thank you.
very
Thank you.
The Sheriff.
Resolution number 894-17, resolution authorizing the acceptance of an Ohio Attorney General Law Enforcement Diversion Program grant for the Franklin County Heroin Overdose Prevention and Education Task Force in the amount of $109,375.
Good morning, Commissioners. Dave Masterson, Director of Administrative Services for Sheriff Baldwin. Passage of this resolution approves the acceptance of a grant from the Ohio Attorney General to augment the duties of our HOPE Task Force through June 30th, 2019. The activities will include investigation hours aimed at locating the source supplier on overdose cases and outreach-based activities for overdose victims to link them to support services for recovery. Pending any questions, I ask approval of this resolution.
If there are no comments or questions, move for passage of 894-17.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 894-17 has been adopted. Resolution number 895-17, resolution authorizing a transfer of appropriations and a purchase order for the return of prisoners.
Commissioners, this resolution authorizes the transfer of appropriations and the approval of a purchase order to cover the expenses incurred in the pursuit and transportation of prisoners. These appropriations cover the expenses for transporting 45 prisoners during October. The itemized monthly reports have been submitted and approved by the sheriff. And with no questions, I ask approval of this resolution.
If there are no comments or questions, move for passage of 895-17.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 895-17 has been adopted.
Thank you.
Thank you. The County Treasurer.
Resolution number 896-17, resolution authorizing a contract with U.S. Bank for banking services in the amount of $299,580.
What you got?
Well, hello.
Ah, thank you.
Last time we
Thank
were
you.
here, we
Yeah.
noticed you had scarves around your neck.
We did.
Yeah.
That's for
We
sure.
wanted to compete with the
Wow.
other people.
Hey.
As a representative from
I have
COSA.
a feeling Kosik's going to be around a little longer.
I hope so.
Yeah.
Commissioners, my name is Sam Gresham. I'm the Deputy Chief from the Treasurer's Office.
Good morning, Commissioners. My name's Julie Grimes. I'm Director of Financial Operations for Cheryl Brooks Sullivan, our new Franklin County Treasurer.
How are you,
And we
Julie?
are here to present the RFP results for our banking service contract. We publicly advertised as required by ORC, and we received 5 proposals for our banking services contract, none of which were smaller emerging businesses. We adhered to all the Franklin County purchasing requirements and specifications, and based on our evaluation team, there was a unanimous decision based on the services and pricing of all of the bidders' responses that U.S. Bank was the lowest and best bidder for the services that we were requiring. So we are requesting approval of the contract for a term of 3 years, starting January 1st, 2018, when continuing through December 31st of 2020. This contract will also provide for 2 one-year renewal extensions under the same terms and conditions. And pending any questions from the Commissioners, we'd ask for your approval of this resolution.
If there are no comments or questions, move for passage of 896-17.
I will second.
Moved in second and voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 896-17 has been adopted.
Thank you so much.
Before we leave the innocuous trivia that exists about the Urban League, thanks for acknowledging my 20 years of experience. But what you need to know, 2018, the Columbus Urban League will be 100 years old. And most people don't know that. You also need to know that the first conference held at the National Urban League was at our public library on November 24th and 25th to 1918. So the first Urban League conference was held here in Columbus. So in essence, the Columbus Urban League is coming home.
I
Very
love
nice.
that.
Very nice.
That's great.
Thank you.
Thanks,
Thank
Sam.
you.
You're welcome.
Yeah. Mr. Blue Skies.
I've been watching all the meetings.
Well, we gotta show this, so yeah.
Thank you.
All right.
Love
All right.
that.
Job and Family Services returns.
Resolution number 897-17, resolution approving a contract for on-site case management services between the Franklin County Department of Job and Family Services and Ohio Health in the amount of $69,135.37.
Good morning again. Joy Bivens, Director of Franklin County Job
Back
and Family
director.
Services. Per the contract, Franklin County Job and Family Services will provide a on-site case manager at Grant Medical Center, 8 hours a day, 5 days a week, to provide timely assistance in determining patient eligibility, primarily for Medicaid, however, for all our other benefits as well. Pending any questions, I would ask for your approval of this resolution.
If there are no comments or questions, move for passage of 897-17.
Second.
Moved in second and voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 897-17 has been adopted. Resolution number 899-17, resolution approving a contract agreement with Franklin County Probate Court for adult protective services, guardianship services in the amount of $150,000.
Commissioners, as you know, the Title 20 service program is intended to enable residents to improve self-sufficiency, support independent living, strengthen family life, and as you know, again, our agency is responsible for administering the Title 20 block grant funds locally via contracting for necessary services. This includes working with the probate court and the public guardianship board to fund and oversight and other protective services for elderly adults who require court-appointed guardians or social workers. The board serves adults ages 60 and up who refer to the court for adult protective services by the Franklin County Office on Aging as a result of abuse, neglect,
exploitation. The court-appointed social workers will provide direct assistance or make arrangements when necessary to ensure approximately 75 to 100 adult protective service referred seniors receive the necessary services that they need. Pending any questions, I would ask for your approval of this resolution.
If there are no comments or questions, move for passage of 899-17.
I'll second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 899-17 has been adopted. Resolution number 900-17, resolution approving a subaward agreement with Future Ready Columbus for their early warning indicator information system, providing intervention training and support to community agencies in the amount of $1,138,443.11.
Commissioners, for the past several years, our agency has partnered with Future Ready Columbus to make student data to obtain student data from their CHIVE and Learning Circle tools available to community agencies. CHIVE tracks data for children in early learning settings to support kindergarten readiness. By monitoring children's strengths as well as areas for improvement, CHIVE helps track performance, measurements, effectiveness of early learning programs. It also helps identify opportunities to align with promising practices or develop continuous improvement strategies for early learning programs. Learning Circle is an early learning indicator and intervention system that monitors attendance, behavior, and core academics data for K through 12 students. The Learning Circle dashboard allows users to analyze early warning indicators at the student's classroom level and district level. It is also available for many of our after-school or summer youth program providers. This data is accessible at the click of a button, allowing partners to identify at-risk youth in need of intervention and monitor effectiveness of classroom strategies. Pending any questions, I would ask for your approval of this resolution.
If there are no comments or questions, move for passage of 900-17.
I'll second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 900-17 has been adopted. Resolution number 901-17, resolution approving a subaward agreement with Tech Corps Ohio for the Youth Computer Science Workforce Development Program in the amount of $229,289.18.
Commissioners, Computing Career Corps is a 15-week program designed for high school students to increase participants' knowledge of and skills in the computer science field. The program introduces students to a variety of technology career pathways, including programming, software engineering, robotics, or app development. The students earn badges for mastering different skills, equipping them with the tools to compete in the 21st century's technology-based economy, and making them more attractive to college admission counselors and potential employers. These are good-paying, in-demand career fields that students might not otherwise be exposed to. Over the year of 2016 and 17, 70% of the participants met the program completion requirements, with planning to enter college or pursue other STEM career paths. Pending any questions, I would ask for your approval of this resolution.
If there are no comments or questions, move for passage of 901-17.
I'll second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 901-17 has been adopted.
Thank you, Commissioners.
Thank
Thank you. Fleet Management.
Director.
Resolution number 902-17, resolution authorizing fleet management to begin the process of purchasing a new in-car video system.
Good morning.
Good morning,
Charlotte Ashcraft, Director of Fleet Management. The first resolution before you is requesting authorization to begin the process to replace our in-car video system for all our patrol cruisers. Our current system is outdated and no longer supported. We purchased that system in late 2006, early 2007, and is beginning to fail with no repair parts available. Fleet has used all available pieces and parts and have exhausted all avenues to get more. The Sheriff's Office conducted research and selected the WatchGuard system, which is on the GSA contract. Fleet wishes to begin the transition process now in order to take advantage of a discount of $31,900, and a purchase order will be opened in the ensuing fiscal year. Pending any questions, I request passage of this resolution.
So, Charlotte, did we have any, speaking of the in-car video system, did we have any issues with the IT slowdown with the city, with their when they went down Sunday and Monday, don't we?
Not that I'm aware of any of our
Okay.
specific issues. So.
All right. I know they had some IT problems this weekend, don't we?
Yeah,
Don't we
they do.
contract with them? Ken?
Kenneth Wilson, County Administrator. President O'Grady, I'm not aware of any county instances of being impacted by the
Okay.
city going down.
I got you. I thought with some of that, I thought with the IT, with the, no, I got you, with the
The radio,
law enforcement, I
radio
thought-
systems, yeah.
Yeah, we have, I thought we do some, we contract with them. I'm looking at Director.
Did we?
But we didn't have any impact in, okay, good, that's good, that's good. Cool, great, good to know.
Good to know.
Thanks, sorry. Now we could. I lived with it this weekend, so I'm okay with it, but I'm glad we didn't have any in the sheriff's department, so go ahead. Can get a motion.
Oh, thought you were talking again. Move for passage of 902-17.
Second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 902-17 has been adopted. Resolution number 903-17, resolution authorizing disposition of personal property, including motor vehicles and equipment that are no longer needed for public use or are obsolete or are unfit for the use it was acquired, and authorizing the Director of Fleet Management to dispose of said items by transferring title to other governmental agencies in Ohio by internet auction or selling as salvage.
The second resolution is to dispose of 12 vehicles and one piece of obsolete equipment. We have several other counties asking for donations. The smaller counties have limited resource to replace vehicles. Our patrol cruisers operate 24/7 and our mileage accumulation is much higher than theirs. Donating a cruiser to another agency saves on the cost of removing the decals and the equipment and also helps the other counties. Some of the other counties have lost vehicles due to accidents and are looking for assistance to get them a vehicle back on the road. After the donations are decided, we will post the remainder to govdeals.com, and those that are totaled will be disposed of appropriately. Pending any questions, I request passage of this resolution.
This has always been such a good program for the smaller counties.
Yes, most definitely.
If there are no comments or questions, move for passage of 903-17.
Second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 903-17 has been adopted.
Thank you.
Thank you, Cheryl.
Thank you, Cheryl. Sanitary engineer?
Resolution number 904-17, resolution authorizing the increase in the countywide rate structure for water and sewer services.
Good morning, Commissioner. Stephen Renner with the Department of Sanitary Engineering. The resolution before you, our water rates and sewer rates are driven by three main drivers. The water and sewer rates from the city of Columbus, because we are a master meter community, increasing in operational maintenance costs and regulatory pressures to upgrade and replace our aging facilities. The City of Columbus Public Utilities plans to increase their 2018 water and sewer rates by 1% and 2% respectively. That means 1% on the water, 2% on sewer. Therefore, we are also recommending to do the same in kind, and I respect your approval of this resolution.
If there are no comments or questions, move for passage of 904-17.
Second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 904-17 has been adopted. Resolution number 905-17, resolution authorizing a contract agreement with Peterson Construction Company for the Timberlake Water Treatment Plant Upgrades Project in the amount of $857,000.
Good morning, Commissioners. Ryan Stowe with Sanitary Engineers. Sanitary Engineers requesting approval of a construction contract with Peterson Construction Company for the Timberlake Water Treatment Plant Upgrades Project. The county's Timberlake Water Treatment Plant, located in Norian, Ohio, provides drinking water to the subdivision of Timberlake and Village of Harrisburg. The treatment plant was designed to be constructed in two phases. The first phase, which only included minimal treatment processes needed to produce drinking water, was completed in June of 2011. The second phase, which is this project, includes installation of a skid-mounted nanofiltration system that will produce softened water for the residents, a pre-engineered building for chemical storage, and improvements to the existing electrical and interior of the existing building. Peterson Construction Company was determined to be the lowest and the best bidder. The total contract sum of $857,000 will be paid from the Department of Sanitary Engineering's general fund. Construction is expected to be completed in late 2018. Pending no questions or comments, we respectfully request approval of this resolution.
If there are no comments or questions, move for passage of 905-17.
Second.
Moved and second in voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 905-17 has been adopted.
Thank you, Commissioners.
All right, Economic Development and Planning.
Resolution number 906-17. Resolution authorizing a subordination agreement with Edmund Coleman to allow for a second mortgage on his property at 2208 Mifflin Boulevard, Columbus, Franklin County, Ohio, 43219.
Good morning, Commissioners. Jamie Edwards with the Franklin County Economic Development and Planning Department. Edmund Coleman received a water quality grant for $2,125 in November of 2007. He is requesting a subordination to receive a second mortgage with Home Loan Investment Bank. This second mortgage would be for renovation to his property. This investment will increase his property value, which also benefits the community. The taxes are paid in current. Pending any questions, I request your approval.
If there are no comments or questions, move for passage of 906-17.
Second.
Moved and second in voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 906-17 has been adopted. Resolution number 907-17. Resolution authorizing a subordination agreement with Edmund Coleman to allow for a second mortgage on his property at 2208 Mifflin Boulevard, Columbus, Franklin County, Ohio, 43219.
Commissioners, Edmund Coleman received a second water quality grant in August of 2017 in the amount of $4,658. He's requesting the subordination to receive a second mortgage to renovate his home property. This investment will increase the property value, which also benefits the community. The taxes are paid in current. Pending any questions, I request your approval.
If there are no comments or questions, move for passage of 907-17.
Second.
Moved and second in voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 907-17 has been adopted.
Thank you.
Excellent. Human Resources.
Resolution number 908-17. Resolution authorizing the extension and modification of the Metropolitan Life Insurance Company, MetLife, contract to provide a voluntary short and long-term disability program to members of the Franklin County Cooperative Health Improvement Program.
Good morning, Commissioners. Assistant Director Jody Lease from the HR Department. This resolution approves an extension with modifications of the existing contract with Metropolitan Life Insurance Company. MetLife provides a voluntary short and long-term disability program to the Franklin County Cooperative. All benefits eligible members within the cooperative have the opportunity to purchase this coverage. This extension is for 36 months, so it begins January 1st of 2018 and extends through December 31st of 2020. The short-term disability rates are being held at the current rates for the entire length of the extension, and the long-term disability rates will be held for the first 2 years of the extension with a 20% rate increase cap for year number 3, which would be plan year 2020. So pending any questions, I request approval of this resolution.
If there are no comments or questions, move for passage of 908-17.
Second.
Moved and second in voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 908-17 has been adopted. Resolution number 909-17. Resolution authorizing a contract extension with modifications with the Staywell Company to provide wellness services for members of the Franklin County Cooperative Health Improvement Program in the amount of $450,000.
This resolution extends and modifies the contract with Staywell Company, the Staywell Company. Staywell provides the virtual or online presence for our Thrive on Wellness programming. This extension is for 12 months. It begins January 1st of 2018 and ends December 31st of 2018. The modifications to the contract include third-party access to Staywell's Compass system, which will support our 2018 Thrive on Wellness programming, as well as adjustments to communications, data management, and health coaching participation. As a result of the modifications, we were able to decrease the cost of this contract by about $50,000. So the total cost of the 2018 contract extension would be around $450,000. Pending any questions, I request approval of this resolution.
If there are no comments or questions, move for passage of Resolution 910-17.
Second.
909.
I'm sorry, 909. Marked it.
909, yeah.
909-17.
Second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 909-17 has been adopted. Resolution number 910-17, resolution authorizing a contract extension with modifications with Right Bite, doing business as Alife Wellbeing Strategies, to provide wellness services for members of the Franklin County Cooperative Health Improvement Program in the amount of $450,000.
This again is another extension with modifications with Right Bite or Alife Wellbeing. Alife provides the boots on the ground services that support our wellness programming. This extension is for 12 months, January 1st, 2018 through December 31st of 2018. The modifications include support staff for our 2018 wellness programming and includes price increases for items such as flu shots, health screenings, wellness challenges, and certain administrative fees. The total cost of this contract extension is $450,000. Pending any questions, I request approval of this resolution.
Great. If there are no comments or questions, move for passage of 910-17.
Second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 910-17 has been adopted. Resolution number 911-17, resolution authorizing a contract with Sun Life Financial for excess risk or stop-loss insurance coverage for the Franklin County Cooperative Health Improvement Program's medical and pharmacy claims in the amount of $1,020,000.
This resolution approves an agreement with Sun Life Financial for excess risk or stop-loss insurance, as well as authorizing County Administrator to sign all the documentation to effectuate this agreement. The stop-loss insurance transfers risk over for medical and pharmacy claims in excess of $1 million for any individual in any one given plan year to the stop-loss carrier, so it caps the risk that the cooperative assumes. CBIZ Benefits and Insurance Services assists us annually in procuring stop-loss coverage and proposals for such. After strong consideration of the proposals that were received and after negotiations with our incumbent carrier, it was determined that the Sun Life proposal provides the best desired coverage at the lowest cost. The cost for this coverage in 2018 is just over $1 million. Pending any questions, I request approval of this resolution.
If there are no comments or questions, move for passage of 911-17.
I'll second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 911-17 has been adopted. Resolution number 912-17, resolution authorizing a contract extension with Sedgwick Claims Management Services for third-party workers' compensation administration services for Franklin County in the amount of $352,400.
Good morning, Commissioners. Jerry Bauer, Risk Manager with Human Resources. This contract was originally bid through purchasing and resulted in the Board of Commissioners Resolution 0901-14. Department of Human Resources recommends the passage of one extension for additional 2 years. This was allowed in the bid process and called for in the bid process. Pending any questions, I ask for passage of this resolution.
If there are no comments or questions, move for passage of 912-17.
Second.
Moved and second in voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner O'Grady?
Yes.
Resolution number 912-17 has been adopted.
Thank you.
Thank you,
Pass.
Commissioners.
The Board of Commissioners.
Resolution number 913-17, resolution reappointing LaCour Meadows and Kathleen Crest to the Columbus and Franklin County Local Food Board.
Good morning, Commissioners. Eric Janis, Deputy Administrator. Pending any questions, would recommend approval of these reappointments.
Move for passage of 913-17.
Second.
Moved and second in voting, Commissioner Boyce.
Yes.
Commissioner Brown.
Yes.
Commissioner O'Grady.
Yes.
Resolution number 913-17 has been adopted.
Thank you.
Thank you.
Resolution number 914-17, resolution reconciling 2017 appropriations to align with projected ending revenues in the amended certificate of estimated resources.
Good morning, Commissioners. Zach Chileric with the Franklin County Office of Management and Budget. This resolution is our annual review of fund balances to ensure that appropriations do not exceed actual resources at the end of the year. This year there are reductions within 14 funds totaling $14.9 million, primarily related to grant dollars that will be realized in a later year. There are also adjustments for 3 supplemental appropriations across funds to reconcile for obligations through the year, as well as 2 other transfers to meet payroll obligations. Pending any questions, would ask for your approval of this resolution.
If there are no comments or questions, move for passage of 914-17.
I'll second.
Moved and second in voting, Commissioner Boyce.
Yes.
Commissioner Brown.
Yes.
Commissioner O'Grady.
Yes.
Resolution number 914-17 has been adopted. Resolution number 915-17, resolution authorizing a general fund supplemental appropriation to record the administrative fee charged by the state tax commissioner for the collection of the county sales tax.
Commissioners, this resolution authorizes an appropriation of $3,051,324 for the with amounts withheld by the state tax commissioner for collection of the piggyback sales tax. In addition, there's offsetting revenue for this expense that's required to be recorded per guidelines from the Auditor of State. The resolution also updates the sales tax revenue for the year for a reduction of $4.7 million as a result of sales tax collections coming in 1.5% below estimate. Pending any questions, would ask for your approval of this resolution.
So they take more financial revenues from us as we try to do business.
If there are no
One more thing.
if there are no further comments or questions, move for passage of 915-17.
Second, because we have no choice.
Moved and second in voting, Commissioner Boyce.
Yes.
Commissioner Brown.
Yes.
Commissioner O'Grady.
Yes.
Resolution number 915-17 has been adopted. Resolution number 916-17, resolution authorizing the classification of fund balance within the general fund for the economic stabilization reserve and transfers for other reserve and capital funds.
Commissioners, this is the annual year-end transfer resolution. In addition to the $7.5 million added to the rainy day fund to bring the balance to $45 million. Other transfers include $6.4 million to the permanent improvement fund. $5 million of that will cover the build-out costs for the 2 new judgeships that were recently approved by the General Assembly for the domestic court. Also includes transfers of $1.8 million to the Fleet Capital Fund for the purchase of vehicles next year. $1.4 million to Child Support Enforcement as an advancement on their 2018 subsidy to be able to begin operations through the first quarter of the year. We also have $1 million to the 27th Pay Reserve Fund for the next 27th pay scheduled in 2020. $1 million into a newly established Board of Elections voting machine fund to begin the process of setting aside funds for the purchase of replacement voting machines, and $654,000 to JFS for the Public Assistance Fund, as well as a couple other minor transfers. And then the last one is $7 million from the Medicaid Sales Tax Transition Fund to the Public Safety Center Fund to utilize those funds to make an advance for the contribution for 2018. Pending any questions, would ask for your approval of this resolution.
If there are no further comments or questions, move for passage of 916-17.
Second.
Moved and second in voting, Commissioner Boyce.
Yes.
Commissioner Brown.
Yes.
Commissioner O'Grady.
Yes.
Resolution number 916-17 has been adopted. Resolution number 917-17, resolution authorizing the annual appropriation measure for fiscal year 2018.
All right. Before we get to this last resolution, well, second to last resolution, before we get to the budget, just if you give me a second, make a couple of brief comments. And I know it's hard for you guys to believe, but I'm just going to make a couple of brief comments. But I don't want to go too much farther before we reflect on some of the things that have happened this year. I want to first acknowledge the staff of the Board of Commissioners and all of the BOC agencies. for all the hard work you guys have done. Literally nothing that would happen around here if it wasn't for all the work that you guys do. And the residents of Franklin County rely on everything that you guys do every day. I always say you guys make us look good. It's hard to make us look good sometimes, and you guys make us look good every day. So thank you for all that you guys do for us and all that you guys do for the residents of Franklin County. We really appreciate it. I also want to thank these guys, my colleagues. I'm sure Marilyn's just as tickled as I am that Kevin joined us this year. And I'm really proud to keep working with Marilyn. The work that she does is fantastic. These two people are really dedicated and passionate and conscientious, and they're really smart. And I enjoy working with the two of them every day. But this has been a pretty challenging year, 2017. We had some uncertain times. We had a lot of loss of a lot of state funds, federal funds. We had ever rising demand for services. But this county team keeps rising to the challenge, and you guys are pretty amazing. We've continued to work every day to serve the constituents regardless of what the state and federal government seems to be up to, and what they seem to put us up against. We created the New American Advisory Council. We helped to pass the senior option levy. We passed renewed commitments to protecting the environment this year. And we called out our state and federal colleagues when we thought they weren't doing the right thing on things like the state budget, on protecting health care, on DACA, and on gun control. So this year I'm also proud that we helped to lead the fight against drug overdoses with the creation of the Franklin County Opiate Action Plan. And we've broken new ground on a much needed and overdue jail. So I'm also proud that we, with this team here, hosted and under the leadership of, through a lot of hard work of a lot of people here, but under the leadership of Robin Deaver, hosted the most successful NACO conference in recent memory. And we were able to show off the fantastic community that Franklin County is to 3,000 leaders and elected officials from around the United States. So 2017 has been pretty amazing. So thank you to Marilyn and Kevin and the staff here at the Board of Commissioners. I'm pretty excited for 2018. Frankly, one of the biggest reasons I'm excited for 2018 is because I'm not going to be president of the board anymore. 2 years is a long time to be president of the board. I'm happy. I'm happy that somebody else is going to do it because there's a lot. There's a lot to it. There's a lot of extra things you got to do. So get ready. But Franklin County is a pretty fantastic place, and we got to learn a lot. We've all known that for a long time, but I think through NACO this year, we got to learn even more about how fantastic Franklin County really is. And it's a great place to live. We all know that, but it's also a great place to work. It's a great community to work in, but it's a lot of great people here in this county government to work with. And it's I know firsthand, and I know you guys do too, it's a great place to raise a family. This year, I got to learn a little bit differently. I had, not only do I have a 9-year-old who I'm now traveling around the state with. Yeah, she's 9. Now I'm traveling around the state as she becomes a softball player, and I'm traveling around Ohio with her this past fall. And I have a 14-year-old who we're traveling around Ohio with as he's in the band, the marching band. But I also had one go off to the University of Cincinnati this year, as Kevin had one go off to Rhode Island. And then my daughter went to Ireland and spent a semester in Ireland. So we learned a lot more this time about what it's like to raise a family in this community. So Franklin County is a pretty special place. So
it really is.
Thank you guys for all you did again this year. The holidays are a time every year when we pass this budget, when we get to reflect on everything that we do in Franklin County. We got to do it again in another mini way this year with these public hearings that we had over the sales tax extension, and we got to bring in all of our community partners through the budget process and through the sales tax extension. And we got to again see all the things that we do and what we do for this community and how we impact this community. And we get to be reminded as county commissioners what what county government's all about. But you guys are pretty amazing, and the work that you guys do on behalf of the taxpayers every day, the citizens of Franklin County every day, is pretty phenomenal. So thank you. And I don't know if you guys want to add anything, but you're more than welcome.
I want to thank all of our team of employees and all of the residents in the county. And I do want to acknowledge, in addition to all of the things you mentioned, we also created our justice policy team, and they're doing the work that I think is critically important as we look at our residents that are in jail, prison, and coming out and hoping to stay out finally. And sometimes it takes more than 1 or 2 times in and out. I think it's just really critically important, and I'm so proud that we were able to do that this year. And that for me, and having my policy director, former policy director Michael Daniels, take the lead on that, makes me feel like we've done something really special. The work that was done over several years from my office, going now working for the Board of Commissioners, is something that I feel very proud of. And Michael's doing really good work, and I know that Homeland Security is still doing the work that they need to do, and that's great and wonderful. And all of our staff doing the work that they need to do for inclusion of all of our residents in the workplace and out of our workplace in the community. So thank you. And we're going to have another wonderful year.
I'm not sure I can add much to what my colleagues have said other than to say thank you. Definitely to my colleagues first and foremost. It's been great learning under you and working with you on so many things. I mean, you touched on it, but I could think of 10 other things that we did together in a way that impacted this community on a level that will always have meaning. And so it's just a pleasure to work with you. So easy to work with. And I enjoy that about this job. It's got to be the best job I've ever had, you know, because Franklin County is truly just a great run organization with wonderful people, and it really reflects and represents what Central Ohio is all about. And so I definitely want to thank my colleagues, the administration, who helped me in my transition, but also have been just every step along the way. I think the kind of organization that you want as a leader, you know, you want information, you want facts, you want detail, and we just have such a strong organization to provide those things, and that's throughout the administration. And then my staff people, Jessica and Tamara, just haven't missed a beat, and we've been working together, and they do everything I ask and more, and so I'm just so appreciative of the work that they do and the commitment. Finally, I do want to say to all the employees of Franklin County, I mean, this is a tremendous institution, and I hope, I see the dedication, the work you put in, but I hope that you take time over the holidays to reflect, to enjoy your family, and to really take a moment and take a deep breath, because next year is next year, and the challenges that will come, we don't know what they are. And so you enjoy the moments that you can during the holidays, but get ready for a year that may bring a lot of interesting moments. And so happy holidays to everyone. Thank you so much for all you do, and look forward to working with you in 2018 and beyond.
All right. We read the resolution. You want to move?
Most important step.
917.
917, okay. Move for passage of 917-17.
Second.
Moved and seconded in voting, Commissioner Boyce.
Yes.
Commissioner Brown.
Yes.
Commissioner O'Grady.
Yes.
Resolution number 917-17 has been adopted. Resolution number 918-17, resolution of the Franklin County Board of Commissioners to convene into executive session for the purpose of discussing pending or imminent court action.
Move to convene into executive session to confer with an attorney for the public body concerning disputes involving the public body that are subject to pending or imminent court action.
I will second.
Moved and seconded in voting, Commissioner Boyce.
Yes.
Commissioner Brown.
Yes.
Commissioner O'Grady.
Yes.
We're now in executive session.
All right. See everybody in 2018.
Comfort break. Comfort break.
I'm going to just take...